Hey, good morning, everybody. Oops, that was my dog. Sorry. This is Dr. Missy, medical school, class number 3. Got a couple of things I want to tell you today. One is, I'm not wearing my rings anymore. And I have my wedding band that I just hardly ever take off. But you know, I started thinking about it last night because tomorrow I'm going to post a video on how a surgeon, this surgeon, it's just my opinion, how I would wash my hands in 20 seconds. So basically the most efficient use of 20 seconds I can give you. And the first thing I thought about was, my goodness, we always had to take our rings off to wash our hands. And we couldn't wear our rings in surgery. So I thought to myself, we're going to take our rings off. I am, because that's a metal surface. So didn't they just tell us that metal surfaces can hold this virus for 3 days? Well, if I wash my hands, I think I've washed them well, but then underneath the surface, the virus is still there. Maybe an hour later it'll sneak out on your hand, and anyway, I just think it's a potential source of contamination. It's a potential thing that might get us sick. Y'all sick, we're already sick. We're doing better though, don't worry about us. Might get you sick and you're not even aware you're doing anything wrong. You're washing your hands all day long, but you've been wearing a metal surface. So I've got my wedding band right here on my necklace, and I'm actually trying not to fondle it either because I don't want to have a contaminated hand touching my ring and back and forth like that, but it is where I can see it, and it still makes me feel really good. So my first tip today is, I would ask you to consider taking off your rings. I know they're important to you. Put them in a really safe spot that you could look at. Maybe wear one, but don't touch it. Treat it like the face, where you're not touching that potential source of contamination, okay? Okay, that was my first thing. That's actually not what today's class is about. Today's class is about the fact that I made 2 very large mistakes yesterday. The first one was, today's day 11. Yesterday on day 10, I was feeling better. And so I didn't drink as much water. My urine wasn't, you know, when you drink plenty of water, your urine will get quite clear. Not water clear, but it won't be dark yellow, certainly won't be brown. That means you're very dehydrated. So anyway, I didn't drink as much water. You know, I had coffee and I had some cranberry juice and I had some water, but not as much as I had been doing. The other thing is, I felt pretty good yesterday. So instead of doing 4 of the pulmonary toilet treatments, I didn't do any. I was like, oh, I've got this, it's no problem. And you know, that was really dumb. To go from 4, that my lungs and the little bitty hairs and everything, to go from 4 treatments on that to none. And last night it was really bad and we had to do one, but it was so bad that Phil's triceps wore out. I was still coughing. It wasn't a good situation. So we're about to do a pulmonary toilet. Again, don't worry about me. I know I sound like crap, and I'm full of crap. Well, hopefully not, you know, not informational crap, but anyway. I just want y'all to get better if you get sick, and avoid sick if you can avoid sick. And tomorrow I'm going to show you how to wash your hands like this surgeon would in 20 seconds. Now, I am wearing my watch. I was thinking about whether or not I should wear my watch, and I realized that no, I can't remember the last time I touched my watch to my lips. So I think it's okay to wear your watch, but I guess if you wanted to be super careful, let's say you're on chemotherapy, you're really immunocompromised, you have multiple medical problems, now is not the time to worry about what time it is, okay? Take your watch off. Store that too. Put it in a safe place. I don't want you guys to get angry at me later because you lost all your rings and watches. All right, here we go. We're going to do pulmonary toilet. Some of you may want to turn the video off because I just think this is disgusting, and I'm sorry, but there's no way for me to avoid, and I know it's good. So I encourage anybody else who has junky lungs, do everything you can to cough it up. So Phil's going to show us. I didn't wear my COVID t-shirt with the lungs on it, but remember, he's going to be working along the front lower rib cage, the side lower rib cage, and especially the back lower rib cage. Any segment that he's percussing or clapping on, if it starts to make me cough a lot, he's going to concentrate on that area until I can get a couple of breaths in without coughing stuff up, and then he'll move along. He's also going to do my entire back, and he'll even get the front up here. This is kind of a hard area to get with that cupping technique. These are much better, and thankfully they're more effective too. So here we go. Thanks for joining us today. Class number 3, pulmonary toilet and postural drainage. Okay. No, I'll put that under me later. So again, we put that one arm up, and he's going to start down. Oh, that wet's hard. I'll give you a thumbs up when I cough something up. Oh. First few days, we weren't getting anything up front here, but the last few days, we actually get quite a bit up front. Oh. So I'm kind of sweating again like I did yesterday. Actually, you're right. I made another mistake. Let me get my lungs down. On the side, I did it that way because remember I told you yesterday that when you lay on your right side, your left main bronchus, that thing coming down off of the air pipe, is straight vertical to the ground. So if you're going to lay on your right side, it's okay to do what we just did, and it drained really well. You saw that. But these other areas, and especially this, when I get this one done, it's got that pipe that's more at an angle, so you're going to have to use this and get your left hip up compared to your left shoulder down, okay? All right, here we go. Now's the time, instead of fighting the breathing, is breathe out through your mouth, big mouth. Breathe in through a small mouth. Don't hit me yet. Remember I said you gotta get your left hip up. It's not that easy to do. I don't know if I got enough pillows here, but you'll get as many pillows as you need to get that hip up and that shoulder down, okay? That'll make this thing more vertical. Oh boy, that was like a 2 thumbs up. So around to the front. Thumbs up. All right, you get this right here. So he's worked on the back and the side, and he'll know, the person thumping knows what position you need to be in so they can thump you. I'm gonna breathe in through my mouth, through the small hole. I'm really sweating a lot right now. Oh yeah, that was a good one. 2 thumbs up.
It's your phone.
Yeah. So now on the front, remember, if you're in a situation, don't just do this lower stuff. Oh, you're slapping me. I cup it. Oh, yeah, thanks. Part of it's not slapping me, but you see the way my skin is bare here? You want to have a layer of cloth on you when they're doing this, or it'll hurt. Oh yeah, much better. Okay, normally I would sit here in the 2 postural drainage positions. One is right side flat. This bronchial tube is straight down gravity. And I'm gonna do the breathing. Hey Gibson, it's okay. Come here, it's okay, sweetie. He gets nervous about mommy being hurt. Anyway, right now, so I'm laying flat on the right side. So my left lung with the straight gravity will drain well. And now, see, it made me out of breath because of all that coughing. But that's okay. I'm not going to run to the emergency room now. I know that in 5 minutes it's going to get a lot better. If it doesn't, I would. You know, you can't have shortness of breath for a long time, but a few minutes is okay. Anyway, I'm going to breathe out. Oh boy, that was a good one. So it's draining, okay? So I'm gonna keep doing this until I no longer am producing phlegm, and I'm able to breathe in and out like that about 5 times in a row, no problems. That means this lung is, thank God, entirely clear, okay? The next thing, I would roll onto the right side on that hip thing underneath my left hip. Remember, getting my left shoulder onto the bed so I get the angle, and then that bronchus is more vertical. Same thing, those slow breathing exercises, cough up phlegm. That's all I got for you today. Tomorrow we're going to learn about how to wash our hands. Take your rings off, store them, put your favorite one on a necklace. I love you guys. Thank you for being so nice to me. Bye.